Good day everyone! We are the Group 6 and we're going to discuss the lymphatic disorders and immunity. I am Sharimi Nicolas and let's start with lymphadenitis. Lymphadenitis is the medical term for enlargement in one or more lymph nodes, usually due to infection. Lymphadenitis may occur after skin infections or other infections caused by bacteria such as Streptococcus or Staphylococcus. Sometimes it is caused by rare infections such as tuberculosis or cat scratch disease. Symptoms may include red and tender skin over lymph nodes, swollen, tender, or hard lymph nodes, and fever. Lymphadenitis treatment and management as follows: antibiotics to treat any bacterial infection, analgesics or painkillers to control pain, anti-inflammatory medicines to reduce inflammation, cool compress to reduce inflammation and pain. Also, surgery may be needed to drain an abscess.
Lymphadenitis refers to the inflammation of your lymphatic vessels. It's a complication of skin infections, but it can also occur in people with certain types of cancer and other health conditions. Lymphadenitis treatments include antibiotics and anti-inflammatory medications. Outlook is usually good with prompt care. Lymphadenitis symptoms may include red streaks on your skin, headaches, fever, chills, fatigue, a slow healing wound, and a swollen lymph nodes in your groin or armpit.
Good day everyone, I am Hasni Villanueva and for today I will going to discuss all about lymphedema. Lymphedema is the swelling of tissues with lymph caused by the obstruction or excision of lymphatic vessels. Lymphedema symptoms include swelling of the legs, arms, or other parts of the body. It also includes limited movement, heaviness, tightness and aching, and hardening or thickening of the skin.
Good day everyone, I am Mayros Barrios. I will be the one who discuss about lymphoma. So what is lymphoma? Lymphoma refers to types of cancer that begin in lymphatic system. Also a group of malignant neoplasm which arise from white blood cells. The definition of lymphoma is any neoplastic disease from lymphoid tissue. The symptoms of lymphoma are swollen lymph nodes, night sweats, fever, fatigue, red spots, backache, vomiting, radiation therapy, chemotherapy, and shortness of breath.
Good day everyone, I am Marian Jemima V. Villasilio from BSN10 and now we will talk about the immunity in lymphatic system. Immunity is the ability to resist the harmful effect of microorganisms and other foreign substances. There are two types of immunity, the adaptive immunity and innate immunity. Adaptive immunity exhibits specificity and memory, while innate immunity does not show specificity and memory.
Specificity. Specificity is an ability of adaptive immunity to recognize a particular substance. Cell-mediated immunity is essential for fighting viral infection.
Good day everyone, I'm Mary Ann Soriano and let's proceed to memory. Memory is the ability of adaptive immunity to remember previous encounters with a particular substance. Thus, responses are faster, stronger, and long-lasting. And next, immunotherapy. Immunotherapy treats the disease by altering immune system function or by directly attacking harmful cells through stimulation and inhibition.
So let's move on to immunity. The first one is the interferons. Interferons are proteins that are part of our natural defenses. They tell our immune system that germs or cancer cells are in our body, and they trigger killer immune cells to fight those invaders.
Good day everyone, I am Kislin Sumawang, so let's proceed about complement. Complement refers to a group of 20 or so proteins that circulate in the blood in an inactive form. Provides a major mechanisms for destroying foreign substance in the body. Symptoms of complement disorders can vary wildly depending on the specific disorders and the parts of the body affected. They might include recurrent infections, fatigue,
joint pain, unexplained inflammation, or kidney problems. It's important to remember that these are complex conditions, and if you are someone experiencing symptoms, it's best to consult with a healthcare professional. They can provide a proper diagnosis and treatment plan. Thank you.
Body-mediated immunity or cell-mediated immunity is an immune response that does not involve antibodies but rather involves the activation of macrophages and NK cells, the production of antigen-specific cytotoxic lymphocytes, and the release of various cytokines in response to antigen. Cell-mediated immunity is directed primarily microbes that survive in phagocytes and microbes that infect non-phagocytic cells. It is most effective in destroying various infected cells, intracellular bacteria, and cancers. It also plays a major role in delayed transplant rejection.
And next, we have IgG, or what we call immunoglobulin G. IgG is the most abundant antibody in the serum. IgG activates complement, increases phagocytosis, can cross the placenta, thus can provide immune protection to the fetus and newborn, and it is responsible for Rh reactions. IgG is the only immunoglobulin that can pass through the placenta. The mother's IgG antibodies provide protection to the fetus during pregnancy and to the baby during its first few months of life.
Good day everyone, I am Elian J.M. Santiago from BSN 10, and now we will tackle about IgA. What's IgA? IgA is secreted into saliva, into tears, and mucous membrane, found in colostrum and milk.
IgA is the most abundant type of antibody in the body, comprising most of the immunoglobulin in secretions and a significant amount of circulating immunoglobulin.
IgM acts as antigen, binding receptors on surface of B cells. It also responsible in transfusion reaction in ABO blood system. It also serves as the first line of host defense against infections. Also play an important role in immune system and immunological tolerance.